Thank you, Bindu. Thank you so much for the introduction. Right now, I am on the stage, and the pressure will be on for me for the time. Okay? I think most of me knows, everybody knows me here. I'm Dr. Sudha. So I'm not here to teach anything. I'm just here to wake us up from inside out. What is that we take away from this message? We have so many understandings of 3 to 3 day back-to-back knowledge-based sessions. But what is that actually we are taking home? And what is that we are actually implementing tomorrow when I see my patients? Now that's how I see my lectures, and that's how I see my knowledge-based. Tomorrow I have to implement something which I take back. And that's how it's supposed to be. What is that I can implement? So I'm going to put some points where you can right away implement in your case-to-case practice right away. So I'm going to summarize everything, whatever we are doing and we are acknowledging. So the topic given to me is gut-brain axis. So in this, knowing with FINIM and NEMCON, we know this terminology. And actually, I gave the same lecture 10 years ago in the same platform. So what changed? So I was surprised when Dr. Sri gave me this topic. I'm like, wow, what changed? So something which I gave a topic 10 years ago to now, a lot of things have changed. In terms of data, in terms of research, in terms of double-blinded control studies, things have literally changed. And so that's why I'm here to go back in time of that 10 years and right now and to the future. So the gut-brain connection. So it is a two-way communication network. If you can remember as a gut-brain connection as a two-way communication network, so between the gut and the central nervous system. Okay. And the central nervous system. So if we can remember this, that is a two-way connection, then, that's the first thing that we need to think how it can be different. Now, these two-way connections are interlinked with the immune system, with the vagus nerve, with the enteronervous system, and neuroendocrine system, and a circulate system. So everybody is talking about gut-brain as microbiome, but it is beyond microbiome. Okay? Microbiome plays a crucial role, but what does microbiome and how does microbiome play a crucial role is the key factor here. So when you don't have these things in mind about the interpersonal crosstalk we talk about between the gut and the brain, we will be missing the piece. So we should be familiar with this physical performance and motivation and neurodegenerative disease if we don't pay attention to this crosstalk between the gut and the brain. So this is so well connected between the nervous system, endocrine system, and the immune system. Now these three are so well connected that's why today we have more research on the gut-brain axis and the gut-brain microbiome, and so many therapies in terms of vagus nerve and vagal therapies. Now we all learned this back in medical school about what is it as in the nervous system, the central nervous system and the peripheral nervous system. Now coming back to the gut-brain, it is not only the peripheral nervous system, which is an autonomic nervous system, but when it comes to the gut, you have your own enteric nervous system. So this is the whole scenario of an enteric nervous system, which is completely interlinked so deep that we tend to miss this communication between the sympathetic, parasympathetic, and the enteric nervous system. Now, how is this connected? Why didn't we come to this limelight a long time ago? So when the research have been published and the data and the DNA has been decoded in the late 90s and the 2000s, we thought we have all the answers once we decoded the DNA. But still, we were not anywhere close to curing any diseases. That's where we realized it's not in the DNA and it is not in the genetic, but it is in the epigenetics. So when you're talking about when it's epigenetics, we have to go all the way to the womb as well. As the 9 months and the fertilization, the ovulation environment as well. So now when you're talking about gut-brain, you have to go back into the cells, into the embryology of the cells. So from where they have developed. So the gut-brain has developed and part became, together the central nervous system, while the often other develops into an enteric nervous system. So the central nervous system and the enteric nervous system are divided from the same cell. So that's why these two are interconnected deep down, because they come from the same cell, which is division. So when you have this understanding about the cell and a mitosis and a meiosis, you will definitely connect into the future that how they are connected. So it is not the autonomic nervous system, it is the enteric nervous system, which is deep down connected to the cells, which one part became the central nervous system, the other part became the enteric nervous system. So that's why we are so connected with the gut-brain axis, and today we have more research on gut-brain axis and the microbiome. So when the enteric nervous system, they have a lot of neurons in the enteric nervous system, more than 100 million, more than the entire spinal cord. So you have more neurons in the gut, more than your spinal cord. So that's why this is very, very equally important as much as the central nervous system. And the brain in the gut. So no wonder we say gut feeling. No wonder we say, second brain. So why? It's because of there is a submucosal plexus, there is a myenteric plexus, there is a lumen, there are no nerves actually enter this area, but where digestion occurs, the brain in the head and the gut to monitor the conditions of the lumen across the lining of the ball. So this is a mesentery and the submucosal plexus, and this is exactly what happens in the gut. And that's why we get appetite, we get fullness, all the pleasure and the emotional connections with the food is interlinked because of this understanding of the enteric nervous system. So this is what I gave in my talk back in 10 years ago about in a conference where it is a human microbiome. And before the understanding was that we are humans and we have our own genetic code. But in 2000, we understood science differently on what goes on inside us. Now, what is that? That is, we are 10% human and 90% bacteria. This has been published that bacteria in the human body outnumber our own cells. So that's why human cells are 30 trillion and microbial cells are 100 trillion. So 70 to 90%. So who are we? So we have our friends inside of our own microbiome that we need to take care of them. So that's the human genome. When decoded all these genomes, we were still missing some piece. So when we are still missing some pieces of the human genome, that's where 99% of our DNA genes are in the microbial cells and not in the human cells. Now, that's human microbiome genes, and that is the challenge. It became more challenging. Okay, how do we decode the microbiome genes? That's where the whole epigenetic research have begun to a total different trajectory. So this is an interlinked between the brain-related mechanisms, the gut microbiome, the diet pathogens and antibodies, the stress, okay, a microbiome immune loop and a microbiome brain loop, and the brain immune loop. So this made more sense in terms of research about why the gut-related mechanisms, we had neurodegenerative diseases as well as autoimmune diseases that we need to rewrite the books in a different way. Now, it always had in my mind, it did not make sense to me for the 20 years of practice. How did the microbiome can be connected into the gut and brain? So now with the latest research of 5 years, it made more sense because it is not the microbiome by itself. It is the metabolites which produced by the gut microbiome, crosses the blood-brain barrier, can travel through the gut to impact the brain. So what is the research which changed from back then to the 5 years. So we have more research now called metabolites. So it is not the metabolites by the human cells, but it is the metabolites of the microbiome. We have more understanding today. So this is, now to summarize, everybody knows by here what is a microbiome or what is a microbiodata. So microbiome is a collection of microbiome genomes. Microbiodata is a collection of microbes by itself. So many bacteria is a host of the cells. So I keep telling as a humor or as a, maybe it's true that because the environment, the microbes, the parasites came before humans came. What if that we are made as the host for the microbiome? So microbiome decided that we need a host to survive, and that's where human came into existence. This is just an intuition which came in, and more data, that's kind of another thesis that, so we are a host and we are made by the microbiome as their host. So we are controlled by our microbiome. So what is the bidirectional connection? So when I take the bidirectional, because I take in a FINM, I talk about neurotransmitters in depth. So when I talked about neurotransmitters, it still did not make sense how these neurotransmitters play a significant role. When the bidirectional influences your diet, your health, your mood, again interconnected with your neurotransmitters in the gut, again do they play in bacterial growth, biofilm growth, decreased resistance to host, increased virulence and decreased virulence. So now this is a bidirectional influence is what we need to decode in detail. Now we all have this normal microbes or commensals or any kind of bacteria in the gut. Because when somebody comes to the clinic in the other parts of the world, in my US clinic, everybody gets a H. pylori testing for GERD, for gastroenteritis. Everybody out of 100 patients we see, 80 patients get a H. pylori test. Does it mean that I have a H. pylori bacteria, or does it mean it's a flourishing H. pylori bacteria? So we have H. pylori bacteria as a commensals, but it is about the multiplication and causing inflammation. So we check the IgG and IgM when they come to the clinic. It's not that whether they're causing inflammation or a commensal. So they're all existing in our gut. So this is part of our gut microbiome. It's a normal mechanism. But when they change, they become inflammatory. So that's where we say that we are colonized with this bacteria in the stomach. We have H. pylori in the gut, in the colon. We have all these things. But when do they become a disease, or when do they cause the inflammation is the key here. So microbiomes, what do they function? They have a protective function, there is a structural and a metabolic function. And this is again gut microbiome brain communication in terms of hormones, in terms of cortisol levels, in terms of cytokines, in terms of your immune cells, because your gut microbiome is influenced by these neurotransmitters right here. So again, it's a bidirectional communication between sympathetic and a parasympathetic and an enteric nervous system, which is intrinsic nervous system of a GI tract, and a hypothalamic, the HPA axis, we always know. Now coming to the neurotransmitters. So the latest research, what changed, is very interesting in terms of neurotransmitters and gut microbiome. So today we know these neurotransmitters are controlled in the gut rather than in the brain by itself. Now, how do they do it? Is because we have a different understanding as biogenic amines. So when you eat a carbohydrate, protein, and a fat diet, in terms of protein, intake of protein is nothing but amino acids, right? So the amino acids are the precursors of the protein, and then they be part of the production of neurotransmitters. So they are biogenic amines that function as neurotransmitters. So these biogenic amines, especially I'm taking one amino acid, because the whole depth of amino acids is a 6-hour lecture, but one amino acid, which is tryptophan, is a precursor involved in the GI secretion, in gut motility, in brain perception, and maintenance of mood and cognition. So 95% of the serotonin is contained in the gut, in the mucosa of the nerve terminals of the enteric nervous system. That's why today, if you understand Dr. Sri's lectures and FINIM, the melatonin and serotonin are produced in the gut, more receptors rather than in the brain, because of this understanding what we have. So alterations in the serotonin transmission may underlie the pathological symptoms. That's why the SSRIs known as modulate, psychiatric and GI, which is when you may take a lot of SSRIs for a long period of time, they tend to have IBS. So this is an understanding about where serotonin has more receptors, where tryptophan has more receptors and all that. So I went into depth of this one amino acid so you'll understand what I'm saying. So now this one tryptophan, we took it in the diet, and then it has a serotonin pathway, it has a kinetic pathway, and it has an indole pathway. Every amino acid has these 3 or 4 pathways. Now these 3 or 4 pathways, how are they controlled? The tryptophan, the indole pathway is by the microbiome. So when you have the right microbiome inside your gut, the tryptophan is converted into indole sulfate, indole pyruvic acid, other metabolites by the microbiome, which takes care of your gut immunity. Now when you have the right understanding of the tryptophan, when it is a serotonin pathway, where we always talk about the folic acid, the cofactors, we only talk about this in functional medicine when it comes to the neurotransmitters. But I have seen that people have neglected to talk about the indole pathway, the microbiome pathways. So this is where deep understanding is. So this tryptophan is controlled endogenically by the host. So this is the human DNA which goes on, and this goes on in the microbial DNA. The same amino acid, there are different pathways in a different understanding of microbial DNA and the human genome. So that's why we have more research in this. So that's why we have understanding of numerous sensations under the vagal system, the gut microbiome, again celiac disease, the IBD and IBS, they are totally different. The IBD is an inflammatory bowel disease as an autoimmune disorder. Now IBS is an inflammatory bowel syndrome, which is a functional disorder. So that's where we differentiate between an autoimmune disorder of the gut and a functional disorder of the gut. That's why we are different. When you say, people go to the gastroenterologist and say IBS, it's a functional medicine pathway. The IBS has to be understanding differently versus IBD. So that is where the gastroenterologist yet to discover or relearn the functional way of understanding, because the microbiome and the metabolites, that's where we are missing the link. Still the IBS, they say, oh, it's IBS. But what is IBS? It's not IBD. So when you don't have autoantibodies in celiac disease, but you have other testing, which is zonulin and all that, which is still not available in India. So that's where, because we don't have enough testing, that's where we are not able to prove to the real, medicine that these two are different. Now, we have enough understanding about every neurotransmitter and a microbiome. Which microbiome controls the neurotransmitter? It's not the other way, that the neurotransmitter is controlling the microbiome. So we have so many details of, as research of 2024, that in Alzheimer's, we replaced, because we are not getting anywhere controlling the neurotransmitters. Are we getting anywhere controlling the neurotransmitters in terms of Alzheimer's or Parkinson's or anything? Because we are using these, modulating the neurotransmitters, and we are not anywhere close. That should make us think. So much of research and so much of data and so much of funding, so much of this thing, and we are still stuck here controlling the neurotransmitters or modulating the neurotransmitters, and we are still not getting anywhere close to any better. So that's where the microbiome came in place. So lately we have, again, I'm going to take into depth of one condition so that we understand as a latest research. So just to off-bite, okay, something going, because this is very, very important. Everybody talks about, again, when it comes to about diet part. So I thought, little bit of what is the studies that we have done on diet, concluding the microbiome based on the diet. So there was a study, small-scale studies, which are crossover design, 5-day consumption of diets composing entirely of animal or plant products, and what did the microbiome respond to? So plant 70%, animal 70%, and plant 20% kilocalories. Now this is what we got. Fecal communities clustered in enterocyte, distinguished by the levels of bacteroids and provetel as a microbiome. So the people who had protein and animal fat had more bacteroids, and people who had carbohydrate diet had these microbiome. So the response of a microbiome is totally different to the people who are doing a carbohydrate source, protein source, or a fat source. So that's where we differ. If I'm going to give a common diet to everybody, according to the culture, we are different. In South now, I eat appam only when I come here. When I come here, I don't pick up, idli dosa, but I eat appam here because it's localized and because I want to change my microbiome. Okay, I want to be exposed to a different microbiome. You have to think that way, what you're eating and what you're putting, because we are eating for the microbiome and not for our own pleasures of food. So this is where difference in any kind of bacteria in terms of source of food. Again, metabolites. Microbiota derived by signals. Again, what are the metabolites which are producing is carbohydrate, protein, and fat. Now there's lots and lots of research on short-chain fatty acids, which has been the metabolites of carbohydrate and fermented mainly to short-chain fatty acids. So short-chain fatty acids have multiple effects on the host. The energy source of the host, bitrate being consumed mainly by the colonic epithelium. Acetate becomes availability systemically. Circulating can be carried by the cross blood-brain barrier. So these are the metabolites which is causing the blood-brain barrier and causing neurotransmitter effect. So again, short-chain fatty acids, again plant-based increased short-chain fatty acid, acetate and butyrate. Animal-based increased branch-chain fatty acids called isovalate and isobutyrate. So the metabolites are itself is different from a carbohydrate, protein and fat. Again, it's the same thing. Again, microbiomes and the metabolites. These are the metabolites and the neurotransmitters. So now these metabolites, when they cross into the brain, and then what are the neurotransmitters that are going to function? Which is serotonin and GABA. This much deep, intricate mechanism happens back in the gut and the brain. So again, that's why we talk about carbohydrate source, metabolites, and the neurotransmitters, and in anxiety and depression patients when you talk about different gut hormones and neuropeptides. So the neuropeptides which are being interlinked for the behavioral energy and homeostasis and cyclical. Now these are the neuropeptides which have been interlinked in the gut as well, which plays the role of the short-chain fatty acids or metabolites. So germ-free studies suggest that gut microbiome meditates and regulates the release of gut peptides. Again, these are the different types of plant-based, botanical origins and chemical structure. So the botanical origins and chemical structure is the cellulose, beta-glucans, inulin and polydextrose. Now polydextrose is a small sorbitate which is usually used in food industry. So they are chemically similar. So when you're doing science, you cannot do a research or produce which is not biosimilar to our natural mechanisms, right? How did we come with artificial sugars, aspartame and everything? They are very biosimilar to our natural molecules. So that's why they have more industry, now more in terms of additives which came in. But today we understand there's inventions where for a better reasons in a small volume, but when you take a large volume, they cause inflammation because of the food industry, because they're botanical origin, but they are more of a chemical structure which is right there. So everybody knows what's a prebiotic, probiotic and symbiotic, so that's what I don't want to do it. So prebiotic is a substrate, probiotic is a live microorganisms, symbiotic is a product that contains both pre and po. So again, according to that same study, they were given this microbiome, a 4-week intake of 250 grams of fermented milk by healthy women, which had these kind of microbiome in that fermented milk. This were the numbers of the microbiomes, which are beneficial for general signs of anxiety, depression, and reduced cortisol. So that's where we are in. 20 years ago, when I was in medical school, I had to remember antibiotics for the disease, right? So 25, 30 years later, 10 years from now, the medical college students or we have to remember which microbiome has to be given as a substitute for when treating anxiety and depression. That's where the data goes in. So you have to register which microbiome to give to which disease. That much intricate research and controlled studies have been done. Again, increased attention, again positive versus negative feedback. Again, galacto-oligosaccharides, 5.5 grams per day, reduced walking salivary cortisol. So the microbiome that we needs to give and reducing of anxiety and dampening effect of fight and flight response. So that's where we are heading. Now prebiotics are these foods, again can be some supplements. So the onion, so I always have a question, why am I eating an onion? Why am I eating a green? Why am I eating this, legume? So what is that which goes on? So either you are eating a prebiotic or a probiotic or a symbiotic or a psychobiotic, so I'll get there. So is what you need to go on in your mind while you're giving on your food plate. So that's what we do when we are doing a food plate. Okay, what are you eating and why are you eating for what you're eating? This is the same slide. Again, why fermented foods as supplements? Why? Because it's a probiotic by live microorganisms. So neurologically, again, physiological connection, it's a bidirectional again between a dietary fiber, prebiotic, probiotic, which impact the human health and microbiota. So we are going to the next segment of signaling. Okay, signaling of the brain, which is a microbiota. So when it comes of signaling, it is gut motility. Again, for the gut motility, you need to have different types of flow rate leading to small intestine and bacterial overgrowth. Again, regional intestinal transit times affects water content and nutrient availability and bacteria clearance rate. Because this again, gut motility, constipation as you go age and Alzheimer's. So this is what you need to think about gut motility. And an intrinsic intestinal barrier. So as a leaky gut, we know this picture. What is leaky gut? Now tight junctions. These are made with the tight junctions. Okay, this is what leaky gut is. So you have these tight junctions here between the healthy gut and the leaky gut. You see this breakage of tight junctions. So that's where the intestinal content, the mucus layer is disturbed, and these tight junctions are disturbed. And we test these in the stool to see if this is there, and this is how you diagnose whether the patient is having a leaky gut. So increased leakiness facilitates the translocation of the bacteria such as E. coli and their products. So it is not the E. coli by itself, because the E. coli is a normal part of the commensals, but the products that they produce called lipopolysaccharides, called the LPS, leading to pro-inflammatory environment in the gut. So people say, oh, the E. coli came positive. The E. coli will come positive. The urine, everybody comes, UTI, bacteria will come positive. But what is that symptom? So in my UTI patients, I don't use antibiotics. I always think of the mind as biofilm versus what is the microbiome or a probiotics that I need to give so that the E. coli doesn't produce the lipopolysaccharide, which is causing the inflammation. So that's how you have to think in your mind, how are we going to be different if we use the same pathway? How are we going to be done as different when we know we come from antibiotic world, and how am I going to be different today? So this is where our thought process needs to be into picture. So direct modulation of gut microbiome, again, I'm going to go into depth here in terms of neurotransmitters. Again, E. coli family, how is he playing in the 5-HTP? So, we have Bacillus family, we have Bifidobacteria family, and we have neurotransmitters. Now, this E. coli and Lactobacillus directly integrate between 5-HTP, acetylcholine, and GABA, which Enterococcus and Streptococcus families, they integrate and modulate neurotransmission in the proximal synapses of the enteric nervous system. Here we are talking about production in the enteric nervous system, not on the only in the autonomic nervous system. So host neuroendocrine system can communicate with microbiota more directly with a luminal release of host of the 5-HTP. So these are released in the lumen and transported to the brain. So epinephrine and norepinephrine are shown to increase the virulence and properties of the several enteric pathogens. So gut microbiome shows a circadian rhythmicity. That's why you sleep, your gut, how is your sleep? Because they do play a significant role. Now, altered gut microbiome profile in brain disorders. So again, I took only one brain disorder, so we go in depth. I'm sorry, I might be running in time, but in Alzheimer's, today we are using only microbiome, I understand, I know. Thank you so much. So in Alzheimer's, the Parkinson's disease patients, today we stopped giving all the acetylcholine receptor drugs versus we are giving the microbiome to enhance the neurotransmitters in the gut rather than pushing the neurotransmitter of acetylcholine in the brain. So fecal microbiome transplant is what we are doing in Hyderabad quite a lot, but the FMT doctor and we both work together. So if the fecal microbiome transplant doctors don't work with the functional medicine doctors, the FMT is not going to work. Lately, we have a patient who had the FMT in our clinic, in our colleague's clinic, but still was not replaced with the proper microbiome. Still, there were not results. So FMT, by only setting centers for fecal microbiome transplant, we still not going to complete the picture. We still have to work integratively with the microbiome. So then I took the patient back and saying, let's give a gap and then let's replace your microbiome with and the patient started feeling better. Because in FMT, for patients with depression, results in transfer of depression phenotype from that. So again, there are a lot of FMT results yet to be published in terms of what bacteria are missing in a depression patients and what microbiome which needs to be replaced. So as of now, I'm comfortable replacing the microbiome rather than going into the details of the FMT. So depression and anxiety patients, again, comorbid with IBS. Preclinical studies show that microbiota capacity modulate emotional behavior. Depressions, human to rodent fecal microbial transplant have induced depressive behavior in the animal models. So this is again positive results. Again, I looked at stress, I looked at anxiety, this will be given into detail. I looked at Parkinson's disease in depth. And then this is what it is. When I looked at your melatonin, the pathway that I presented, in the gut, there is tryptophan, which is causing this pathway by the microbiome, which is controlling by the neurotransmitters, whereas here we are acting about the substitutes, which again causes anti-inflammation cytokines or pro-inflammations. So this is the bidirectional cross talk, which goes on inside our microbiome. So the gut brain here, the live organisms, now we're talking about psychotropics. So we're talking about psychotropics, that's what the word we're going to come to for prebiotics, probiotics, symbiotics to psychotropics. So we have enough amount of data today about of these microbiomes are psychotropics, which can be used for anxiety, depression, neurodegenerative disease, Parkinson's, Alzheimer's, and all that stuff. So that's where we come. The next So autism spectrum, that's why we have patient gut-related comorbidities and unusual dietary patterns. Bifidobacterium reduced abundance in autistic spectrum disorders, and Clostridium is increased in abundance. So the people who have already diagnosed of autism, we are checking the gut microbiome and saying what is reduced and what is increased. Again, then treatment with vancomycin resulted in positive alterations in the behavioral pattern. But again, FMT from healthy individuals into the ASD patient resulted in improvement in both gut and other behavioral patterns. So we looked at different medications. Now coming to the medications, the metformin is the widely used medicine for quite a bit of time. So they took the same metformin, has altered in the gut microbiome profile in type 2 diabetes, and the other is the citalopram. The long-acting citalopram called SSRIs for 6 weeks in cohort study, also recently published because increased microbial alpha diversity in a cohort in depression patients. So we have all the studies. You can go through the whole thing called psychobiotics right now, the strains, the European Union microbiome. So we have enough studies of the enzymes and the assay, and I can forward all the things. So I'm going into one depth Alzheimer's disease. Yes, I am run out of time. In Alzheimer's, the gut microbiome transfers information into the brain and how a brain cognitive functions. So in Alzheimer's, what is happening is the intestinal permeability is imbalanced. The dysregulation of the neuroinflammation is happening. Enteric immune dysregulation is happening. So these are all things which are happening in the Alzheimer's disease. Now, based on the observation and challenging, we did this. This is a link which we have, I have put here. So these are the studies we replaced only in the mice. In the studies I've looked at, 28 days of given this kind of microbiome with curcumin. So with curcumin also, that's exactly what we are doing in our clinic right now, called probiotic enemas. So that's how, Dr. Leroy came up with this, discovery, saying that probiotic enemas with the curcumins that you used made a huge difference in our practice. So that's where we looked at these studies, 14 days of lactobacillus, inflammatory cytokines, and memory is damaged. We will be able to see these results in 28 days and all that. So basically, oral administration or an enema. So that's maybe in Ayurvedic, maybe they understood this long time ago that we never understood the science behind the enemas. So today, the modern medicine is accepting the probiotic enema way and the enema, and that's where we need to go back into the modern science to the traditional science that they were science-based, but we are reproving according to today's science. So my gut microbiome and enemas have been done, and these particular probiotics, group of probiotics, is what we are choosing in terms of that. Again, not the least, okay, the last but not the least, the vagus nerve. So a lot of research are going on the vagus nerve. So this vagus nerve is being interconnect into the enteric nervous system so deeply, and that's where we are here. So a lot of treatments on vagus nerve therapies are targeting to stimulate the vagus nerve, because the modern science always wanted devices, all that. So this is what is happening now. Stimulation of vagus nerve. Naturally, I teach patients to gargle every day in the morning while brushing. I teach patients to hum bathroom singing. Okay? If you're good at it, if you love it, please do it. Okay? The cold exposure, the hot exposure, the cold treatments and the hot treatments, gargling while brushing. I tell the parents to teach the children gargle in the morning and gag reflexes. Why? Because of the vagus nerve. Now these are the devices which are coming in terms of VNS stimulation. People are going back into the vagal nerve stimulation. These are the devices in our clinic also we started using in the US. So that's where we are getting into the devices about what kind of device for vagal stimulation. Again, this is what happens in the vagus nerve and the splenic nerve, and this is the published data. So when you're talking about gut microbiome, please pay attention to all these things. So now 5 years, what changed in my practice? A lot of things have changed. I'm not practicing the same way 20 years ago, 10 years ago, or 5 years ago, or 3 years ago. Because from 3 years, I have changed into a cognitive kind of man. Because we understand, we have other teams, but we as a functional medicine, for the past more than 10 years into this ecosystem, we have to think different. So now the mind is different from the brain. So the mind-gut connection as a human nature, we have to come into pay attention to the emotional intelligence of the patient. So today we are more emotional coefficient is also, we are linking in. So I do a lot of psychosomatic sessions and we go deep down into all these things. Okay, because we have data today. We have enough diagnostics about how our body looks, about why we are doing what we are doing. So the heart-brain connection is again autoimmune. We have enough data that emotional needs is also connected to the chronic illnesses and the microbiome. So this is what we did. Hiding emotions, progressive emotions needs to be addressed. Overeating, overdrinking is hiding emotions. So this is what we need to pay attention. This is the sessions only for the past 4 years post-COVID. I started the psychosomatic medicine theory in terms of post-COVID because during COVID we had to keep up the to keep them, to keep them happy. So that made a huge difference for me in my COVID patients. I said, okay, this has something else. So I do something called psychosomatic medicine now, and then which is integrate. And this is what in the depth we go in a psychosomatic symptomology sessions, and 3 hours for one patient in my psychosomatic medicine. And this is where we go into depth because this is what we speak. This is what we talk. This is what we give our time, saying that because I want to cure, I want to touch multifactorial and multifactorial. So a healthy anger is about knowing your boundaries and expressing it. If you're caring for others, you must demand support also for yourself. So healthy anger, again, ask yourself, reflect on this question, is what is a situation in your life which is what you need to. So pay attention to your patterns. So I started paying attention to my own patterns. The way you learn to survive may not be the way you want to continue to live. So the healing versus shifting in the thought process is different. We are coming from a survivability of the olden days to a quantum science. So we survived, but when we are going to the quantum energy and a quantum healing, we need to have the shift in the mindset. So this is what, lend yourself to others, but give yourself to yourself. As Dr. Ushi has said, be true to yourself, but as much as then you can be true to others. So we go into depth of these. Again, coming back to the microbiome. The microbiome runs the planet. It is not only the humans, but it is animals, plants, and the culture in the environment. Now that's where we are. It is a microbiome world. There are 100 million times as many bacteria on the earth as stars in the universe. Microbiology is the ultimate big data science. And yes, who am I? Thank you for your attention when you're saying, who am I? For the next time, don't feel lonely because you have friends inside to take care of yourself. Okay? And keep your microbiome happy, so your cells in your body. And thank you to your microbiome to keeping us happy. Thank you so much. This is Dr. Sudha.